Okay, so last time when we had a call together, we talked about scars, the psychological effect of scars, and laid the groundwork for selling the NewGel product line. Today, we're going to dig into some of the more specifics, and we're going to talk about clinical evidence and some of the specifics about the products themselves. So let's get going. So historically, when silicone products were first came out, they were used more to treat abnormal scars, meaning they were used to help fix hypertrophic and keloid scars. As time passed, doctors started saying, well, geez, if they're going to help it, maybe we should see if starting them early before we see a sign of hypertrophic or keloid scar formation, maybe we would get a better outcome. And so studies were started, especially after the silicone gels were developed along with the sheeting. And what the doctors began finding is that if you prevent a scar, if you use a silicone product as a preventative measure, you will get a better outcome of the scar than if you wait until the maturation process is over and see what the result is and then have to treat a hypertrophic or keloid scar. It is always better to prevent than it is to treat. And this is a very, very key selling point for all of you. Based on some of the feedback we've gotten from your doctors, it looks like you are currently talking to them about the prevention, but I know, excuse me, I know from my past companies that sometimes the distributors focus too much on fixing hypertrophic and keloid scars and do not spend enough time talking about prevention. And, you know, especially the cosmetic surgery patient is a very demanding patient. And I think selling with that prevention method or message is going to be key for you as you grow your business. So a lot of the questions that we get is, well, how does this work? You know, you put this silicone on you, you put this patch on you, how in the world can that work? Well, there's been a lot of research into silicone products, and the current mechanism of action theory was published way back when in 2008, and it was done by Thomas Musto, who was actually associated with the Northwestern University in the Chicago area, close to where our offices are. And it has maintained its place as the key mechanism of action theory ever since. Nothing has come out with any other points to say that, no, maybe this isn't true. This seems to be what everybody has been going with as the mechanism of action due to Dr. Musto's very, very thorough research. And what this theory is that when you apply silicone sheeting or silicone gel, you reduce the transepidermal water loss, and therefore you restore homeostasis and normalize collagen production. So as we know, our bodies are always trying to find that happy medium, that homeostasis level. Homeostasis meaning if you have a fever, you start to get the chills and you sweat and things to try and bring your temperature down. If you're very cold, you shiver and you will shiver and your hair rises on your skin. All of these things are designed to help increase your body temperature. There's a whole host of things, your endocrine system, your thyroid, all of these things are always trying to stay in the right balance. If it's too high, it tries to bring it down. If it's too low, it tries to bring it up. Your skin is no different. There is an ideal amount of transepidermal water loss, which is the water evaporation through your skin, and your body will always try to maintain that homeostasis. Some of you may sell products that are barrier repair products. Barrier repair products are usually for conditions such as eczema, psoriasis, things like that, where the barrier function of the skin, the lipid layer, the ability to maintain water is somehow compromised, and so you would use these barrier repair products to try to make up that difference and restore homeostasis. So with a scar, what we find is that the homeostasis issue is the amount of water loss that's happening through that scar tissue. So when a scar closes, it fills in that deficit where that incision was, where that burn was, with new epithelial tissue. But it's patched with a less mature version, and over time it converts to a stronger version. What happens with this weaker version of collagen is that it allows too much water to evaporate from the skin. When too much water evaporates from the skin, it sends signals to your body to produce more collagen, essentially to plug the leak, which will result in an abnormal scar. So think of this as your house. If your house has tiles on the roof and you have a leak inside your house, you have too much water coming through your roof, what is going to happen? You're going to go up and you're going to patch the roof. You're going to put more roof material on top of your roof to help prevent the leak. That's exactly what happens with your skin. You will have this extra water loss that's coming out of the skin, which is primarily collagen, a lot of collagen based. So with that leak, your body tries to replace the roof with more roofing material, essentially triggering the body to make more collagen to help protect it and provide a stronger barrier from that water loss. And that's how you end up with an abnormal scar. So what happens under the skin is your body is full of signaling mechanisms. And so you have the keratinocytes trigger the cytokines to trigger the fibroblasts to produce more collagen. So there's this whole cascade of events that happen, almost like the messenger system. If you picture, somebody saying, "Hey, we need more of this," that person tells the next person, "Hey, we need more of this," and it goes down the line with this messaging until you have more collagen production. And as you can see on the right side of this image, left unchecked, excessive collagen production. Somebody not muted. If you can make sure you're muted. So how does silicone fit into this? So silicone helps to prevent abnormal scar formation in new scars, in that it essentially tricks your body into thinking that there is no problem with that immature epithelium, and makes your body think that all is well, that there's no leak, that everything is good. What happens is that silicone, whether it be a gel or a sheet, is applied over that scar, and it helps prevent excessive transepidermal water loss. And without that excessive transepidermal water loss, you don't have the keratinocytes and the cytokines and the fibroblasts all signaling each other to make more collagen. So your body essentially feels that it's in homeostasis because the amount of water loss is normalized, because it provides a semi-occlusive layer that helps to control that. When you have no extra collagen signaled for, because everything is quote normal, the scar will heal flatter and softer. And after 2 to 3 months of silicone treatment, collagen is normalized and hypertrophic scarring is prevented. It becomes a mature type of collagen. Type 3 goes to type 1, and that type 1 collagen is a much stronger collagen, and then you have full maturation of the scar. A quote from the clinical study itself says, "The mechanism of action of these products," meaning silicone products, "is likely to be occlusion, and that similar occlusive properties of silicone gel and silicone gel sheets explain their equivalent efficacy in scar management." So you've got both the gel and the sheeting that, when they're applied to the skin and when they are on the skin, help prevent that excessive water loss out of the skin, and makes your body tricked into thinking everything is normal. I believe that I had sent to Ahmed the clinical study of this particular clinical study, along with some other ones. If you guys have not received them yet, I'm sure he will be sending those soon. So we have this mechanism of action theory But you may be wondering, well, what else is out there and what else is being used for treatment and what is the most effective? Well, a lot of doctors have wondered the same thing. And so a group of SCAR experts came together in 2002, and they reviewed all of the literature out at that time regarding SCAR treatment. And what they did, there were 10 doctors from 7 different countries, and the same Thomas Musto, who did the mechanism of action theory that we just talked about, he was the lead author on this. And they reviewed over 300 published references, and from what they've learned from all of that is they built a treatment algorithm which will guide doctors worldwide on both the prevention and the treatment of scars. In this first recommendation is probably one of the first time that you saw a major publication discussing the need for prevention. They say silicone gel sheeting should be considered first-line prophylaxis or prevention beginning soon after surgical closure when the incision has fully epithelialized and be continued for at least 1 month. Now, we say 2 to 3 months. 1 month for sure, you would need it, and that's going to be when that epithelium is at its most fragile and weak. And but we do recommend we treat for 2 to 3 months, but this is saying at least 1 month. On the treatment side, they say that silicone gel sheeting is recommended in the treatment of immature hypertrophic scars, linear, which would be surgical or trauma, incisional type of hypertrophic scars, widespread burns hypertrophic scars, and minor keloids. So pretty much every single type of scar with the exception of a major keloid, think very large lumpy scar, they recommend silicone gel sheeting as the first line treatment. And this was in 2002. So this has been updated as well, but this was the original algorithm. And if you see here in the orange, that is where silicone gel sheeting fits into the treatment protocol for scar prevention. So if you look at the top, let me see if I can do an arrow here. So right here, if you can see my arrow, when you have surgery or trauma, you have to look at the risk of scarring of that patient. Is the patient at high risk of scarring? Then they recommend you use silicone gel sheeting. If they're at an increased risk, they also recommend silicone sheeting. If someone is at a low risk of scarring, if the doctor feels that they don't have a high risk, but the patient is concerned about it, then you would want to give them silicone gel sheeting. And if they're not concerned, it could be a watch and wait, but most patients are concerned with how their scar looks. And so silicone gel sheeting would be the best option. The great thing about silicone is that it is a purely topical product. Nothing is absorbed into the body. There's no systemic involvement. It's essentially like wearing a Band-Aid or a plaster on your skin. And there is no long-term issues or risks or anything. So it is a very, very safe option to use even on children. Oops. Oh, wait, I think I have to turn off my arrow. Hold on, technical difficulty. I don't know why it's not letting me change. Okay, there we go. So we had that in place from 2002, and at that time, prevention was something new to doctors, and also silicone gels, the topical silicone gels that come in a tube, were also relatively new. They were developed in response to silicone sheeting being somewhat cumbersome and not great to use on areas that are exposed, like on the face, places that have a lot of curves to them, like especially like your face or joints, any place that's you're trying to move like over a joint, it becomes more difficult to keep the sheet adhered or it doesn't look so great. So the silicone gels were developed, and at the time of the 2002 clinical recommendations, there wasn't a whole lot of data on them. So they mentioned the silicone gels, but not in depth. They basically said they have promise. So in 2014, a new group decided to take a look at what has happened since the last one was published. So Michael Gold, who is a dermatologist here in the United States, he was the lead author of this update. Dr. Musto participated, but he did not take the lead on it this time. Simultaneously to this group, this update of this international clinical recommendations, the European plastic surgery and dermatology groups also developed theirs, and we'll get to that one in a second. So in this 2014, the algorithms for scar prevention and treatment, you'll see an additional support for silicone gels as well as sheeting. And they also add the caveat about sun protection, stating how vital it is to have sun protection to minimize and prevent hyperpigmentation. And ideally, scars should not be exposed to sunlight during the healing period. Prior to this, people thought that was, it was just kind of a common thing to say, keep your scars out of the sun. But this is the first time that we really had direct instructions to make sure that scars are protected from the sun. So here is the complete management algorithm that's relatively similar to what was put forth the first time. And as you can see across the top, let me see if I can get my arrow again. Oops. We have the immature hypertrophic scar, which would be a red and slightly raised scar. We have a linear hypertrophic scar, which would be a red, raised, itchy type of scar. And then we also have widespread burn hypertrophic scars, which we're all relatively familiar with. With these types of hypertrophic scars, you can see the first line is to apply the prevention algorithm, which would be to use silicone gel or sheeting, hypogenic paper tape or onion extract. For the linear hypertrophic scars, it says to use silicone gel or sheeting for 2 months. Widespread burn scars, it also says to use silicone gel or sheeting, pressure garments, and or onion extract cream. And if you follow these down, it gives you, each column gives you what the steps should be to continue the treatment. If this one doesn't work, then you go to this. If this one doesn't work, you go to this. And as you can see right here, under the complete management of burn scars or immature scars, if that hypertrophic scar persists for 1 month, then you would treat it as a linear hypertrophic scar and you would move to this column. So you'll have this. I also gave Ahmed all of these studies that we're talking about right now, and you'll have these algorithms there for you to study. But one of the other things that very important to talk about is down here at the bottom, it says surgical excision plus postoperative silicone gel or sheeting. So that would be for what we call the surgical revision, scar revision surgery. And that is where a doctor would go in and actually cut out the old scar and stitch it back up, and then use some different mechanisms to ensure that it heals properly this second time. And so they recommend definitely using silicone gel or sheeting immediately after that to help make sure that any abnormal scar formation is prevented. And that's key, because one of the neat things about silicone is that it doesn't have to be an either or product. You can use silicone in addition to any of these other therapies listed here. You can use laser followed by silicone treatment. You can do corticosteroid injections with silicone. In fact, sometimes doctors will have the patient use a series of, or a couple of months of silicone treatment to help try and soften and shrink that scar a little bit, so it's less painful when they get it injected, and also so that they don't have to use as much steroid when they inject it. So you can use it prior to or after cortisone injections. You can use it along with pressure therapy, and having the topical gel makes it really nice because you don't have to try and get a sheet flat under those pressure garments. It's very difficult to get it flat. So you can use it in addition to pressure therapy under a garment, and you can use it after surgical excisions or anything. So you can do a treatment and silicone. It doesn't have to be a treatment or silicone. You will get additive benefit from using silicone gel in addition to whatever else they're doing to help manage the scars. Oops, I gotta get out of this. So at the same time,
Lisa,
yes,
can you hear me?
yes.
Okay, great. So just to add to what you just mentioned regarding, we found like even like for stretch marks, that sometimes it's very difficult to get rid of these scars even after laser treatment. We found that several of the laser clinics have great result after laser treatment to apply the gel in the beginning and the sheeting later on for stretch mark removal, including the tattoo removal. So there's a lot of things that you can use the gel and the sheeting post some of these laser treatment like stretch marks or tattoo removal or others. Thanks.
Exactly. Thanks, Mike. So the European, at the same time in 2014, the European group updated their scar management guidelines, and they published it in 2 different papers. One was geared towards plastic surgeons, and it was published in the Journal of Plastic and Reconstructive and Aesthetic Surgery. And then there was also a dermatology arm that was published in a dermatology journal. We'll get to that one in a second. So this was led by Dr. Stan Monstry, and they had 24 participants. And similar to the other one that we just discussed, they reviewed the data, and they reviewed, I believe, with what the other group had presented, and they came up with their own that was to be a European recommendation. So what's new with this is that it adds additional support for silicone therapy, stating that it is universally considered as the gold standard in scar management, and it's the only non-invasive preventative and therapeutic measure for which there is enough supporting data to make evidence-based recommendations. You see that it's not onion extract, not any of these other ones. It is the only non-invasive preventative and therapeutic measure. If you notice that there was some onion extract mentioned in the previous one we talked about, part of that I believe is because MERS, which makes Contract Tubex, was one of the sponsors of the study. And I think to make them happy, they put the onion extract in there. But there is not good evidence-based data on onion extract products. They strongly recommend scar prevention in this study. They said that preventative measures are a major priority and need to be applied before, during, and immediately after wound closure. Now, preventative measures doesn't necessarily just mean silicone. It means making sure that, everything from before, like getting patients to stop smoking so their skin heals better, placement of the incision lines, the types of suturing that is done, the type of suture material that is used, all of these things can play into the outcome of the scar. And then after wound closure, you would want to make sure you have good wound healing procedures in place to prevent infection, because infection can cause a bad scar outcome. And then finally, you would use a silicone product to help prevent abnormal scar formation. So preventing scars doesn't just happen once the wound has reepithelialized and you start using silicone. It actually starts beforehand with the health of the patient and the skill and the strategy of the doctor. So in the dermatology version of the same group, this Dr. Sylvia Moom was the lead author, and there were, again, the same participants. In this one, they talked about silicone-based products such as sheets and gels are recommended as the gold standard, first-line, non-invasive option for both the prevention and the treatment of scars, which is similar to the previous one. And they say other general scar preventative measures, including avoiding sun exposure, compression therapy, taping, and the use of moisturizers. So they definitely include avoiding sun exposure, which is important for those of you who are currently selling our NewGel plus UV product. There was also a study that was released in 2013, and Dr. Musto did this with Dr. Kim, and this was guidelines for treating Asian patients. Now, I know that being in the Middle East, you don't have a ton of Asian patients, but I do know that there are some Asian patients that are there working. And so with this group, it's important to note that prevention is especially particular due to the structure of Asian skin. It seems to have a little bit of a different structure, and Asian patients are at an elevated risk of abnormal scar formation. So this study said that following surgery, scar prevention should be initiated in all Asian patients due to the high risk of poor scars. That means that in any sort of surgery that they have, they should always be aware of the need for scar prevention, not just plastics and dermatology. It says there is strong evidence for the efficacy of silicone-based products, and due to their ease of use, they should be considered the first-line therapy. So again, this is looking at a completely different patient population and a specific patient population, and they also say that scar prevention is important and the use of silicone. So I think we've made the case. The main clinical guidelines are telling the doctors you should prevent as well as treat if need be. Why is this important for you as a sales rep or a distributor of silicone-based product? Well, let's look at the market potential. If you remember last time, we talked about the incidence of hypertrophic scars or keloids. So we know about 15% of scars will be persistently hypertrophic or form keloids. That's 15% of all scars. So 85% of scars over time will heal as normal scars. So your market, if you only are promoting it to treat, to flatten and soften scars, you have about 15% of the entire market of people who have had any sort of surgery or scar. If you are marketing for scar prevention, that is every single patient. It's 100% of all the scars created in your countries. So obviously from a business perspective, it's much more lucrative to pursue the scar prevention as well as the scar treatment, because it opens up a much larger market and a much higher opportunity for you to sell products. Patients, unfortunately, don't come labeled with their scar potential. Somebody doesn't walk in with a name tag on that says, "Hi, I never get bad scars," or "Hi, my scars get red and ugly." We don't know prior to. A lot of times doctors will say, "Do you have a scar anywhere on your body that I can look at so I can get an idea of how you heal?" And plastic surgeons in particular will ask that. But that doesn't even guarantee that a scar on a different place on the body or under different circumstances, or that it's incurred at a different age as the previous one, will heal the same way. It may not heal that same way at all. So patients don't come labeled with the scar potential. Yes, you can look at things like we talked about before, like genetics and skin color and all of these types of things, and make a guess. But we also know that very fair people are prone to hypertrophic scar formation. So you just don't know who is going to form that bad scar. We don't know how they're going to take care of their wound, or whether they can prevent an infection, and all of these kinds of things come into play. So at the end of the day, it's much easier to prevent abnormal scar formation in all patients rather than to fix them once they're already turned hypertrophic or keloid. So giving a preventative product to all patients is going to get the best outcome for the doctor. And I'm not sure how exactly it works where you guys are. But here in the US, doctors depend on referrals, especially the cosmetic and aesthetic doctors. So the patients are paying cash for these procedures. Their insurance is not covering it. And so they want to get their best value for their money. They want a doctor who produces really good results and really good scars. If my friend showed me her scars that she had had a procedure, say I was considering having a tummy tuck and my best friend just had one. If she shows me her scar and it looks beautiful, I'm going to want to go to that doctor. If she shows me her scar and it looks terrible, I'm not going to want to go to that doctor because I'm thinking he doesn't do a good job. Now, it may not have been at all the doctor's fault. He may have done everything the right way, but my friend unfortunately scars poorly. But if you can do a preventative treatment and make sure that that poor scarer heals well, the doctor is going to get a better reputation for producing beautiful scars, and it will increase their likelihood of patient referrals. They will get a reputation for having beautiful scars. You also will save the clinic and doctors time and money by not having to do scar revision surgery on preventable abnormal scars. So many doctors, if a patient, especially for, on reconstructive procedures as well as cosmetic procedures, if after a period of time the patient is not happy with the scar, they can come back to the doctor and have scar revision. With a cosmetic procedure, quite often the doctors will do that free of charge to make the patient happy. And unfortunately, some patients are never happy and they keep coming back multiple times. And so the doctor is not charging for this, but it's taking him clinic time, it's taking him supplies to do the surgery, assistant to help with this surgery. All of these things are coming out of the doctor's pocket or the hospital's pocket. So by preventing this scar up front, you can help prevent having to do all of these scar revisions later and allow them to have more time to do what makes the money, which would be doing the primary procedures like the breast augmentations, the breast reconstructions, the tummy tucks, and all of that. This study, you see these three images here, and this was on a breast reconstruction patient who used NewGel Plus sheeting. So I only show one breast here, but because the patient had both breasts done, their risk of scarring is going to be the same on both breasts. So this is, the first picture is what both breasts looked like initially when they began treatment. This was 3 weeks after surgery. There was no difference in the scar appearance from one breast to the other. In the middle, you'll see the treated breast. After 7 weeks with sheeting, you can see how great that scar looks. It's almost invisible. On the right side is the untreated breast. So one breast was treated with silicone sheeting, one breast was not treated with silicone sheeting. After 7 weeks with no treatment, you can see that even though this is not a bad scar, most people would consider this a good outcome. It's flat, it's soft, there's no terrible discoloration. It's not a bad scar, but if you look back at the treated breast, it is so much better. So even without becoming hypertrophic or keloid, by using a preventative product, you can still get a better looking scar, even not just preventing hypertrophic or keloid. They actually discontinued this study after 7 weeks so that the patient could have this breast treated, because this is the difficulty of doing some of these clinical studies on scar patients, is that when they start seeing one scar, the treated scar, looking better than the untreated scar, they want to stop and they want to start treating the other scar, or they even cheat and they start using the treatment on both scars because they're afraid that one is going to be permanently bad. So just to kind of recap what we talked about, so the 2002 and the 2014 International Clinical Recommendations for Scar Management stated that it is much more efficient to prevent hypertrophic scars than to treat them. It also says the use of silicone gel sheeting should begin soon after surgical closure when the incision has fully epithelialized and be continued for at least 1 month. Very specific instructions to doctors on how to manage scars. The 2014 updated European, both the one for the derms and the plastics, state that following surgery or trauma, the first priority should always be the prevention of abnormal scar formation, and that silicone sheets and silicone gels are considered the gold standard in scar management and the only preventative, non-invasive measure for which there is enough supporting data to make evidence-based recommendations. And as you probably all know, the doctors prefer to make evidence-based decisions on how to treat things, meaning that there is good clinical evidence in published, respected clinical studies or clinical journals that support whatever treatment they choose to use. And then finally, the 2013 update on scar management, the guideline for treating Asian patients, it said following surgery or trauma, the first priority should always be the prevention of abnormal scar formation. So again, reinforcing so in 2013, 2014 is when the big push for using, regularly using preventative strategies has really come to the forefront. So yes, it works great to help prevent scars, but we don't want to forget that 15% that has an older scar. So if you have a patient who has an existing hypertrophic or keloid scar, maybe it was from a trauma where they didn't get follow-up care, or the emergency physicians didn't tell them about using silicone, or it was a C-section scar that nobody told them anything about. You will get people who still get hypertrophic and keloid scars. And of course, this silicone has been studied on doing this exact thing, treating these existing scars since 1980. So here's what types of scars that the silicone gel and silicone sheets have been proven to improve. If the scar is red, if it's hard, if it's elevated, like raised up above the skin, if it's itchy or painful, there are clinical studies showing that the scar can, that silicone can help those parameters, those different symptoms of a scar. Now, if I go back to this picture, when you see that scar in the middle, it's flat, it's white, it's not raised. I don't know if it's itchy or painful, but silicone is not going to probably help that because it does not present with one of these 5 parameters. So if you remember anything, remember these 5 things. It helps with redness, hardness, elevation, itch, and pain. And there are multiple clinical studies showing that both silicone gel and silicone sheeting can benefit all of those symptoms. Another question we get a lot is, how old is too old? At what point is it too late to use a silicone product on the scar? We do know that scars up to 4 years old have shown improvement in clinical studies. I believe that there was a poster presentation that laid that out. Is it going to have as much benefit as a younger scar? Probably not, but it is possible to achieve improvement in a scar up to at least 4 years old with clinical data. Anecdotally, what we hear from our patients and doctors in the field is that it can work on scars even older than that. One of our reps in Florida had a doctor who had a 20-year-old scar, and he thought, let me just see if it will do anything. He was curious, and on a 20-year-old scar, he actually got improvement. And if you look at our before and after photos, we have a split scar study where someone had a 10-year-old hip replacement scar, and they put the sheeting on half of it, and in about 3 weeks they saw a significant improvement in the discoloration of that scar. So it's never too late to give it a shot. There's nothing to lose. It's not harmful in any way. So if somebody is very bothered by a scar and they want to give it a try, I'd say go for it. So that brings us to the end of talking about kind of the background stuff, treating, preventing, all of those types of things. One more thing is that I also had sent out some documents after the last presentation. One of them is a paper on kind of like an extra supplemental paper on age of scar, and there's more detailed information in that if you want to have more information on the age of scar or if you have a question about it. So now let's get to the exciting stuff. Let's talk about our products and start selling. Yes.
Lisa? Oops.
We can hear you.
Oh, okay, I'm sorry. So we have a few questions in the chat. Maybe it's a good time to just answer a few questions, if you don't mind.
Okay, yeah, I don't see. Oh, hold on, let me pull them up.
If we increase frequency application of the NewGel Plus E, this is from Sujad Hassan, application of NewGel Plus E of skin, like applying 3 to 4 times a day. If there is any increase of efficacy or not?
With the NewGel Plus E, so if you remember when we talked about how these products work, the mechanism of action, it is by that physical placement over the scar that prevents that transepidermal water loss. If the product doesn't stay on the scar, it's not going to do anything. That's why on a very severe scar, we like to use the sheeting, especially because we know for sure that there is, as long as that sheeting is on the skin, there is 100% contact with the skin and we're getting that occlusion. With the topical gels, it depends on the location and it also depends on the consistency of the gel. NewGel does a very good job of being a soft, quick drying product that stays in place well. It's not an oily product that rubs off easily. But by that same token, if it is in an area that is prone, say somebody had carpal tunnel surgery and they're washing their hands multiple times a day, they are probably dislodging some of the product. So for something like that, I would say yes. 3 or 4 times a day might be better because the goal is to make sure that that scar is completely covered and occluded for up to 24 hours a day. So if it's, say somebody had a tummy tuck and that scar is rubbing against their clothing all day, or somebody has, due to their work, they say they had a facial scar and they're wearing a mask all the time and they're taking it off and on because they're a medical professional. These types of things, anytime that there's any sort of mechanical rubbing or irritation on the scar, it can also help cause it to thin and dislodge. So if you have frequent washing, if you have an area that's prone to rubbing or anything like that, yes, I do think that applying it more times a day could be beneficial. If it's, say, on a breast, which is like a breast reduction, which is in a surgical bra or in a bra all day with very little movement, you're probably okay with twice a day. So it just depends on the location and the severity.
Yeah. And we have a couple questions from Dr. Wael. One is whether using prevention of the scar gels or the sheeting 1 month is enough to prevent scar from forming. My answer, I know this answer, is if someone has a potential keloiding or raised scar or hypertrophic, 1 month is not enough to prevent scar from forming. Sometimes actually 3 to 6 months we've heard, because the people who has potential of having a bad hypertrophic or keloid, sometimes that keloid after 1 month will appear, or 2 months. So I will definitely use the sheeting, which is much stronger than the gel for these people, and will be at least 3 to 6 months. And then the question from Palestine is regarding, I don't know if you can read it, Lisa, regarding the safety with pregnant women. Can you read the last chat question?
Hold on, let me scroll down.
It says, as to regarding the first safety of use of NewGel for pregnant women. And the second question is whether using the gel in the morning and the sheeting at night, will that accelerate the healing process? So 2 questions.
Okay, so we do have an extra paper that that I composed that talks specifically about the use of the product in pregnancy and on children, because in many ways, the rationale for using it on one applies to the other. And it has a lot of documentation in there. And what it comes down to is that it is safe for pregnant women and babies because it's essentially the same thing as wearing a Band-Aid or a plaster. Silicone molecules are too big to penetrate into the skin. It stays on the surface of the skin because that's the mechanism of action. It stays on the outside, so it's almost like a clear bandage on there. Or with the sheeting, it is the sheeting stays attached. Nothing is pulled from the sheeting or the gel into the skin. Therefore, it does not get into the bloodstream. It does not go systemically through anyone's body. It stays completely on the top. So it's the same thing as using a body lotion. It's the same thing as using a bandage, anything like that that you're applying to the outside of your skin that does not get into your bloodstream and into your skin. That's not a medication is okay to use for pregnant women and for children. And as far as alternating, as we just talked about, the longer you have 100% contact with the skin, the better result you're going to get. So alternating is a good idea. We know, especially for someone who is highly prone to abnormal scar formation, or somebody who already has an abnormal scar, the sheeting is going to be, an ideal use for them. But sometimes, whether it's in an exposed area or it's not comfortable, or they live where it's really hot and they're outside a lot and that makes them sweat, there are times when it's not convenient to use the sheeting all day long. So if they can use the gel, during those times and the sheeting at night, there is to my knowledge, there's no clinical study actually that has studied, using silicone gel versus sheeting versus alternating one or the other. So, I just would use, I guess, common sense and thoughtfulness to look at the situation and determine. So, anytime you're using the sheeting, you are guaranteed to have good contact with the skin and good occlusion. So the more that we can get them to use the sheeting, especially in high risk patients, the better. I don't know if there's any other questions. Let me look down. Nope, I don't see any. There was.
Let's go forward. Thank you, Lisa.
Yeah, okay. Yeah, I was looking back through here. We'll get to them. So let's talk about the NewGel products themselves. So we know that NewGel products can help prevent abnormal scar formation once the incision has fully closed and reepithelialized. And we also know that it will help to flatten, soften, and reduce redness, itch, and pain associated with existing hypertrophic and keloid scars. Remember, this is a medical device. So, we do have, it has to be shown that it will work to be approved as such. It will also, the way that our FDA approval is stated, it says that it's for the management of post-surgical trauma and burn scars. So that pretty much covers almost all scars. Whoops. So we're going to talk about the sheeting first. The key features and benefits of the sheeting is that NewGel is a pure 100% medical grade silicone gel sheeting that's worn daily over the scar. It's self-adhesive, so you don't have to tape it down. It's essentially like a plaster or a Band-Aid. It will help flatten and soften and reduce the discoloration of scars. The thickness of our sheeting is 1 millimeter, which is considered full thickness. And the full thickness in our formulation hits that happy spot between durability and flexibility. So you want something that's going to last a while for the patient, that's going to hold up to use, but you also need something that is flexible enough to conform to the body and feel comfortable to wear. We have choices of clear or beige fabric backing so that patients can determine, pick which one they like better. It is a washable and reusable product. It's not a one-time use and done product. If cared for properly, they can last 3 to 4 weeks each. They do come with a convenient storage tray to place them in when they are not being worn. And they are safe, they're non-toxic, they're non-sensitizing, and they're very biocompatible. Silicone is one of the most biocompatible materials. That's why they use silicone for catheters and all sorts of things. That's why breast implants can be silicone, because your body doesn't reject them. A lot of facial plastics use silicone molds for cheek implants, chin implants, all of that. So silicone is a very, very biocompatible, bioinert product. It doesn't break down, it doesn't turn into something else, it stays as silicone. It's indicated for all types of scars, as we talked about: hypertrophic, keloid, surgical scars, trauma scars, scars resulting from burns, and it can be used on all skin types. Obviously, it's going to be more effective on new scars that are less than 1 to 2 years old. So that's newer scars. And some people think that a new scar has to be like within the first 4 weeks, but we know that scar maturation process takes a long time. So if you can get the scar treated within the first 1 to 2 years, you have a good shot at improving the appearance. It also can be used, as we said before, as a preventative measure by starting to use it 7 to 10 days after the surgery or injury, once that wound has reepithelialized. It's not to be used on open wounds. Whoops, very sensitive. Let's see. Okay, so the way that the NewGel sheeting is structured is pretty neat. So if you look at this image, the blue bar in the blue box in the middle says 1 millimeter thick self-adhesive silicone gel. So there is no adhesive added to the silicone. It is the way the silicone is cured. I think we talked about it before, that silicone can go in a variety of forms. It can be a silicone oil like you have in hair products, all the way to a solid, which would be like the cheek implant, the chin implant, and everywhere in between a gel to a semi-solid like the sheeting, all the way up to a hard product. So what happens is that the silicone, that 1 millimeter of silicone gel, is cured to a point where it's tacky, and it's tacky on both sides. That makes it self-adhesive. Because it's tacky on both sides, we have to put a backing on both sides, essentially. So on the top side, we either put a clear polyurethane backing on it, or we put the beige lycra spandex fabric backing on it, because the whole thing is sticky. On the bottom, we have that pull-off liner, the plastic liner, that will expose the sticky side of the gel. And so there are no added adhesives. A lot of people are sensitive to adhesives, even in Band-Aids and things like that. So there are no added adhesives. It is 100% silicone that is cured in a way to make it very tacky and self-adhesive on the skin. What's the difference between the two backing options? Well, the fabric backed is going to be a little bit thicker. It is stretchable because of the lycra spandex type of fabric that's used, and it can be a little bit more durable because it's slightly thicker. The clear option is very transparent. It's much less noticeable, but it also tends to be a little bit more flexible because it's thinner, and it can help it stay in place well on curved areas or flexures. Oops, did I go too fast? Sorry about that. So the NewGel, whoops, it's got a mind of its own. Sorry, guys. So the strips and sheets, oh my goodness, this keeps changing on its own. We do it this way. Okay. So the NewGel strips and sheets, we kind of talked about strips, sheets, shapes as the essential types of products that we have. A strip by its very nature is going to be longer than it is wide. So we have 1x3 strips. We have well, I guess you guys use the metric. So we have the 2.5 by 7.6 centimeter strips. We have 2.5 centimeters by 15.2 centimeter strips. And then as far as sheeting, we have our larger rectangle that is 12.7 centimeters by 7.6 centimeters. And on this sheet, you'll see that I have a list of types of procedures that this particular product would be appropriate for. So your 1x3 strips, your 2.5 by 7.6 strips, the smallest ones would be good for linear scars less than 5 centimeters because you need to have some overlap on the ends. This is good for biopsies, small lesion removals, liposuction, laparoscopic surgery, small sutured wounds. So smaller linear scars. With the 2.5 by 15.2 strips, this would be good for scars that are as big as up to 13 centimeters. So things like breast augmentation scars, thyroidectomy, chemotherapy port scars, pacemaker insertion scars, bunionectomy on the foot, these would be very appropriate for those types of scars. The larger sheet, the 12.7 by 7.6, can be cut to fit irregularly shaped scars. As you know, many Mohs surgery scars, because they use a flap technique, tend to be very irregularly shaped. You'll see some that look like a big curve, a curve that looks, or some look like a question mark. There's all sorts of different shapes of Mohs surgery. So by having this large one, you can cut it to fit the shape of the scar. Also burn scars, burn scars tend to be covering a wider area. They're not a linear scar, so you need more area covered. And so that's where this rectangular sheet would fit in. The same thing with deep abrasions. We call it in the US road rash. Road rash is when somebody, say on a motorcycle, crashes and their skin gets this rubbed off on the pavement as they slide across it. Anything like that, any type of deep abrasion that covers a larger area would be, this would be a great option for. And also laser tattoo removal. As you can picture a tattoo, it's going to have more of a rectangular or round shape. And so this bigger rectangular sheet is ideal to fit over that tattoo. Oops. I think I missed one. Okay, so, oops. There's a definite delay on this. So the breast shapes, you're probably all familiar with. We have the areola circle, we have the lollipop, we have the anchor, and then we have the breast kit, which includes 2 areolas and 2 anchors. So the areola circles would be perfect for a breast augmentation that is done through the areola, for a breast lift that's done just through the areola area, an areola reduction. Also gynecomastia, that would be for men who has excess breast tissue that needs to be removed. They usually do that around the areola as well. So those would all be good for just areola circles. Lollipops would be for something that includes both an areola incision and a vertical incision from the bottom of the areola down to the breast crease. So that would be appropriate for a breast lift and like a small scar breast reduction, or keyhole, they call those types of scars. The anchor would be used for a breast lift or a breast reduction, potentially. It can also be used for breast reconstruction, depending on the shapes of and the size of the scars. The little part that sticks up on the anchor can be trimmed down if need be. If there's no vertical scar, or if the vertical scar is much smaller, you can trim that part down to fit. The same thing with the lollipops. You can cut the bottom to fit as needed if it's too long. And then the breast kit would be for the full anchor scar, where you have a scar around the areola, a vertical scar from the areola down to the crease in the breast, and then another long scar that follows underneath the breast in the crease. That would be for your larger breast lift procedures, mommy makeovers, and also breast reduction surgeries. See if I can get this. Okay. Oh my goodness, we keep jumping. Okay, so the NewGel strips and shapes. Some of our best-selling products are what we call the tummy tuck strips, and this would be a 5 centimeter by 61 centimeter strip. Also comes in beige and clear, and this is ideal for abdominoplasty, tummy tuck, brachioplasty, which would be to remove excess skin on the upper arms. For breast reconstruction patient, some of the deep flap patients, some of these other types of patients have both scars on their breast plus essentially a tummy tuck scar from where they've taken the tissue that they are using to reconstruct the breast. So with that type of patient, you have multiple scar sites that they would need this for. Joint replacement surgery, such as knees, hips, those types of things, and also scoliosis surgery. When a patient has scoliosis or a curvature of the spine, they often will put rods and screws in the back, like a metal rod that goes the entire length of their back that requires an incision the entire length of the back. So using this larger strip on that would be a very good option for that patient. We also have the C-section strips, which would be good for both cesarean section and as well as hysterectomy. A hysterectomy scar, if it's an open hysterectomy, not a laparoscopic hysterectomy, will have a very similar type of scar as the cesarean section scar. And I've also heard people say that they like the C-section strip for thyroidectomies because of the way the curve is, it hugs the neck well. And it has the rounded edges as well, so it doesn't lift and get stuck on your hair as easily. And then we have our dots, which would be they're 2.5 centimeters across. That would be ideal for a biopsy, small lesion removal, liposuction, laparoscopic surgical procedures where you have those very small incisions. And then finally at the bottom, I'm not sure if any of you are carrying this, but we do have what we refer to as the blanket, which is a very large piece, very large rectangle that can be used. It can be cut to fit multiple scars. It can be used, in different ways and is especially effective for large burn scars and widespread scars like we talked about before, like a deep abrasion that covers a large area of the body or anything like that. So that covers the products that we have, and each of you, each country individually may have a different number or carry different products than the others. The umbilical sphere is a really unique product to us, and this is something that most companies do not have. In fact, I don't know of anybody else that has one like this. The umbilical sphere is looks almost like a rubber ball. It's 100% medical grade silicone. It is a little bit squishy. You can push it, and it gives a little bit. It comes packed with an adhesive tape square, and this would be used for abdominoplasty or the incision after deep flap breast reconstruction or after repair of an umbilical hernia. You put this in the umbilicus, the belly button, and you put the piece of tape over top of it to hold it in place. And what this helps do is two things: is it helps to hold the shape of the umbilicus after the surgery, where sometimes it wants to collapse. And it also can help improve the appearance of the inner umbilical scar, because most times there is a circular incision around the umbilicus when they relocate it when they're doing a tummy tuck. It's relatively easy to use, and it's quite an interesting product that doctors do like. And if you're not carrying that one, it's something to definitely consider because it is something that will set you apart. I'm not going to go in depth into these charts, but we've got here, there's two different charts. This would be procedures that are OBGYN procedures, other surgery procedures, trauma, and on the left, it has the different types of procedures, and then to the right, it checks off which types of products would be most effective for that. I can send these to you as well in a separate sheet so you have them for reference. These are good things to put into your sales binder. And then here's another one for dermatology and plastic surgery. Again, down the left are all of the different procedures, and across the top you have all of our products and which products would be the best fit for each of these procedures. Oops. So this kind of goes back to what we talked about before is, how many times a day should you use it? How do you use this? As we said, 24-hour coverage achieves the best result. So if someone is not diligent with applying it, it's not going to work very well because it's not like a medication that gets absorbed into the skin and may have some residual benefit. It's a purely physical effect that by adhering to the skin, whether it be gel or sheeting, you need it to be there to provide the occlusion that makes it work. So you can mix and match products. You can use the sheeting all day and only the sheeting. You can use the gel and only the gel, or you can alternate them. You can use the UV during the day as a daytime product to help prevent from sun exposure, and then just use the NewGel Plus E at night where you get a higher concentration of silicone. You can use the gels during the day and the sheeting at night, or some people don't, when they sleep, the sheeting gets moved around and doesn't stay in place. So they prefer using the sheeting during the day, especially where it can provide protection from clothing, like in the case of a tummy tuck or a C-section, and then switch to the gel in the evenings. So one of the things that we do know is that a lot of doctors see excellent benefit by starting out using the sheeting on the patient, and then after 4 to 8 weeks, switching the patient to the gel if they want to move to a gel application. In the US, a lot of doctors will actually give the patient the first set of sheets after their procedure as part of their cosmetic package cost, and then once those have been are not sticky anymore, they'll switch them to the gel or have them purchase another set of sheeting. So as we said, the trick is occlusion, and there's no way to mess up occlusion when you have the sheet on. It's guaranteed to be occlusive just by the very nature of that thick layer being on top of your skin. Oops. As far as the instructions for use, you can see a facelift scar here. You want to wait until the wound has completely healed or the sutures have been removed. Don't use it on an open wound. Usually we tell doctors, depending on what their post-op visit schedule is. Some people see patients at 1 week, some people see them at like 3 days, and then at one week after that, so about 10 days. Whatever works best given their post-op follow-up would be an ideal time to have the patient start using it. What we find sometimes is that if they try to give this all to a patient before the procedure or the day of the procedure, it just gets confusing, and so it's almost better to just wait until that follow-up procedure when the surgery and all of that is behind them, and then instruct them on how to use the product and have them start using it at that point. You want to wash and dry the area every time you apply NewGel. You want to make sure that it's clean and that we've gotten any excess oils off so that it has a better chance of sticking well. You remove the product from the package, and if you need it, as we mentioned before, you can cut it or trim it, but you want it to have at least 1 centimeter around all edges of the scar, because it needs that extra width and length to adhere better. You want to keep that liner, that peel-off liner. We recommend that the patient keeps that and the tray, the plastic tray that it comes in, to store the product when it's not in use. For larger products that come in the tubes, like the blanket or the tummy tuck strips, we recommend that you store the product flat with the with the backing on it, backing side down. And when you apply it, you want to make sure, like we said, make sure it's clean. You also want to make sure that the sheeting is applied before the patient puts on any sort of cream, lotion, ointment, perfume, or NewGel Plus E. You don't use them both simultaneously, you use one or the other. If you use the NewGel Plus E and try to put a sheet over it, it's not going to stick properly. If the sheeting comes in contact with any of these things mentioned here, it can lose its adhesiveness, and that becomes a problem for the patient. And because it's not adhering, you just need to make sure that it's clean, dry skin with no other product on it. They peel off the release liner, place it directly on the area being treated with the adhesive side down. And it is self-adhesive, but if need be, or if the patient feels it's not secure enough, or it's like week 3 or 4 and it's not quite as sticky as it used to be, they can use medical grade tape, they can use netting or a compression garment or compression sleeve to secure it further.
Lisa, I just want to, because this is very important for people to advise the clinics and the doctor and of course the patient. Make sure when they are using the sheeting on a clean, dry skin, as Lisa said. So no any moisturizer, nothing. If you have it, it's going to deform that silicone. So that's very key on the sheeting. Plus, very important that sometimes we found, like in South America, some of the doctors having them to use the sheeting right after they remove the suture. Well, that could be also, the sheeting is very aggressive, is very good and powerful. The problem is, please make sure the doctor do not do that, because sometimes when you remove the suture, the scar, the wound still kind of open, whether outside or inside. So you want to make sure to let them know they can try the gel in the beginning for the first few weeks, but we're making sure that completely the wound has to be closed. So they can start with the gel for the first few weeks and then apply the sheeting after a month, of procedures. But if the wound has any oozing or scab, do not use the sheeting at all. So make sure they don't go in. So we're recommending now to allow them use the gel first after removing suture, but then you can go with the aggressive after a few weeks, which is about 3 to 4 weeks of procedure. If the wound completely closed, use the sheeting. Thanks, Lisa.
Okay, the sheeting should be worn for a minimum of 12 hours per day, up to 24 hours a day. Remember, the longer it's on, the more contact it has and the better it can work. So if someone's only wearing it for 3 or 4 hours a day, they're not going to get good benefit, because for the rest of that time period in that day, they're getting that excessive transepidermal water loss out of the scar, and they're not going to get benefit. So you want at least half of the day, even better, up to 24 hours a day on the scar. And they may need to work up to that, a little bit, but over time they should be able to get a long wearing time, because the longer it is in contact with the scar, the greater the effect. If you ever have a doctor that says, "Oh, I don't think this works, it doesn't stick, it's not working," a lot of times, you have to be very diplomatic in how you put this, but a lot of time it is patient error in use. Either they're putting lotions on, or something else on their skin, or they used like an oil to shave in the shower or something like that. We want to make sure that it is as clean and dry as possible. If someone has very oily skin, they may need to even use a little bit of alcohol over it before they put it on to help ensure the stickiness. As the patient should be asked how long they're wearing it, if they're wearing it every day, because a lot of times if there's a problem with either the outcome or the sheet itself, it's because of something that the patient is doing. Maybe not washing it, maybe not doing caring for it the way it should be. The sheeting should be removed once daily to inspect the scar site and to wash it and thoroughly dry the skin. You can get, if it's left on like long term, you can get what they call maceration, which is, if you know what your fingers look like if you've been in the swimming pool for a long time, where the skin absorbs a lot or holds a lot of water. We want to make sure that we avoid that. So taking it off, allowing that skin to dry out, wash the skin, and then wash the sheeting as well will help maintain the integrity of the sheet and protect the skin. And ideally, we use this for a minimum of 3 months, but we do know that people who are especially prone to scars or are treating an older or a more severe existing scar, using up to 6 months is not unheard of and can be beneficial. So basically, they should keep using it as long as they're continuing to see improvement. Each of our pieces of sheeting should last 3 to 4 weeks, and we do recommend that you remove the sheeting when you're showering, bathing, or swimming, or also when you're working out. If you're sweating a lot, you'd want to take it off. To clean it, so if you remember back to when I showed you all the layers, the way that the sheeting is formed with all the layers, we discussed the fact that there is no adhesive added to it. It's just the stickiness of that piece of silicone. So when it's been on your skin and you pull it off and you put it back on, you'll pull up dead skin cells, you'll get dirt and lint attached to it, body oils, all of that. They will get stuck to the sheet, and by being stuck to the sheet, it will reduce its ability to stick to your skin again. So when you're washing, what you're doing when you're washing it is you're pulling all of those things off, so you're re-exposing that the stickiness of the silicone gel sheeting. So you want to wash it using water and a mild soap. Once it's completely air dried, it can be reapplied. I will say this, you want to watch out with creamy cleansers and bar soaps because they can leave a film. If it's a creamy cleanser, it usually has a lot of moisturizers in it, and that does not work so well. We find that foaming soaps seem to work the best. And, again, this goes back to if a patient says it's not sticking, what exactly are they cleaning it with? Because if they're using something like a facial cleanser, like a CeraVe or something like that, it's going to leave behind oils and it's going to inhibit the ability of that sheet to stick. So what they use to clean it can be very important because you want to strip off all that dirt, all the oils, all the dead skin cells so that you re-expose all the stickiness. And we do have, whoops, let me skip right to that. We do offer a cleanser that's a foaming gel cleanser. It's for the sheeting. It's not so much that this works better than anything else, but by giving the patient this, we know that this is an appropriate cleanser for the sheeting. So it prevents the patient from using something that could be detrimental to the stickiness of the sheet. So we find that by selling the cleanser along with the sheet, it helps preserve the life of the sheet. It makes it a better value for the patient because it's lasting them longer. The foaming cleanser is fragrance-free, sulfate-free, it's allergy-tested, it's non-irritating. So it's a very nice, gentle cleanser for the product. And we do get the question, can it be used on the skin? Yes, absolutely, it can be used on the skin. But the main purpose of it would be to clean the sheeting with an appropriate cleanser. Okay, so what are the unique selling points for the NewGel Plus sheeting? It's 100% medical grade silicone. It's been FDA cleared as a medical device. It's a full 1 millimeter thick silicone sheet, which gives it the optimal durability and flexibility. It's very self-adhesive. It does not have to be, in general, you do not have to use tape or something else to keep it in place. It has 2 different backing options, the beige and the clear. It comes in multiple sizes and procedure-specific shapes. I would dare to say that our shapes and sizes are a greater variety than any other product that I have seen. You're going to find definitely a product to fit every single scar. It is washable and reusable, which allows it to last 3 to 4 weeks, extending the value of the product and getting more for your money, so to speak. And we also manufacture this ourselves in our own FDA-registered, ISO-certified facility. So this is not made by a contract manufacturer. We control the quality of our own products. So a very reliable, safe to use product. Oops, we did that. So we get a couple of questions about what if you have sensitive skin, or if you use a sheeting and you see the patient says that they're getting a rash from it. Some people have very sensitive skin, and so with that type of patient, we recommend that you ease into the use. You want to start out with even as little as 2 hours a day, 4 hours a day for the first few days, and keep making sure you're checking the site and that the rash isn't getting worse or whatever. And then if you want to start increasing that wear time by about 2 hours each day until you get the desired usage time. So some people, their skin has to get used to it and it will build up. You should also replace it if it begins to deteriorate or disintegrate or will not stick. It may have more, if it doesn't stick, there might be more things stuck to it that could also irritate the skin. Whoops. And I think that's it for the sheeting. Are there any, Mike, I'm not sure, I haven't been looking at the chat. Are there any questions on the sheeting before we jump into the gels?
Lisa?
Yes, I see one here.
Somebody from Egypt sent you with regarding now, as you know, they are using alcohol for, as you know, for sanitizing because of the corona. What will happen if our sheets can be used after alcohol using in the skin?
If the skin has had alcohol, and well, one thing about alcohol is that it dries very quickly. So if it evaporates. If it's just been cleaned with alcohol and left to dry, and you put the sheeting on, there should not be any problem with that because it does evaporate relatively quickly. You just want to make sure it's dry before you put the sheeting on.
Okay.
Lots and lots of hand sanitizer. If it's on the hand and you wash your hands, or use hand sanitizer, as long as you're not like getting it right up into the edges of the sheeting, it should be fine.
Okay, thank you.
Okay, if anyone else has any questions, just ask in the chat and we will get to them. And then we're going to talk about the topical silicone gel, or NewGel Plus E. Key features is that, the idea of developing a gel is for when sheeting would be either inconvenient to use, hard to secure, or unsightly, like on your face or someplace that's exposed. Somebody may be self-conscious. It's perfect for visible areas such as your face, your neck, your hands, as well as areas of frequent motion, which would be over a joint because of the way bending it, sometimes it will make the sheeting not stick as well. It has a soft, silky feel. It's not sticky or greasy, which is probably one of the biggest differentiators between NewGel and many of the competitors. The best way to understand how our products compare to a competitor is put them side by side on your hand or on a doctor's hand and show them the difference. And it's usually very quick. They'll say, oh, this is very sticky, this is very wet, but this one, the NewGel, is very soft and dry and would be much more pleasant for a patient to use. Since it's 100% silicone, it has no odor, does not leave a residue behind, that's on the skin. It adheres to the skin and literally forms a custom fitted silicone sheet on your skin. You can cover this with sunscreen, with cosmetics, clothing, any of that can be applied over top of the silicone gel. So just like the sheeting, you want to apply it on clean, dry skin. Don't put serums on, don't put moisturizers on, vitamin C, retin A, nothing like that goes on first. The first thing that should be put on the skin is the silicone gel. It should be allowed to dry, and then you can put whatever you want else on your face or your body, whatever, but the silicone gel has to be applied first. So what's in it? We've got 99+% pure medical grade silicone, which is, I think, it's a combination of different types of silicones that that bond together and form that nice, soft, silky feel. There's less than 1% vitamin E in the product, which is tocopherol. It's added as a softener and a moisturizer. A lot of people will say, oh, use vitamin E on scars. That's kind of a catch-22. It's a little bit of a, there are studies that show that vitamin E in high concentration can cause a scar to look worse. At less than 1%, the amount of vitamin E that's in this product is not necessarily designed for scar management, but to add as a softener and a moisturizer. From a consumer standpoint, they hear vitamin E and they think, oh, vitamin E is good for scars. So it can be a selling feature that vitamin E is in there. If you have a doctor who's concerned about the vitamin E, you can reassure them that it's less than 1% vitamin E. It's not a high concentration. And at that concentration, it's added as more as a softener and a moisturizer rather than a scar treatment amount. You would apply it as you apply any ordinary lotion, gently massage it onto the scar area. Some people will say rub it in. Well, you don't really rub it in because it doesn't penetrate into the skin. So the biggest mistake that people make is by putting on too much because it doesn't penetrate into the skin. It's all going to stay on top. And if you put too much on, it's going to stay in more of a sticky layer. So you only need a very thin amount. If it does, it should dry rapidly and form a thin protective gas permeable layer. Usually if you have it, like when we do demonstrations at medical conferences and such, we use the back of our hand to demonstrate the product. And when we go and wash our hands before lunch or whatever, you can always feel it on there, that it stays on there and it's like waterproof. You can feel that the water will bead up on it. So you don't want too much. I would say with any silicone gel, the biggest problem is patients put too much on. They think if a little bit is good, a lot must be better, but because it doesn't absorb, it's just going to sit there. So you just want a thin layer of product. Whoops. We've got, oh my goodness. This thing is so sensitive. Okay, so we have a 15-gram tube size, which is enough for a full course of therapy, using it twice daily for 90 days or 3 months for scars 8 centimeters or less. So, when doctors say, well, which size should they use? If their scar is bigger than 8 centimeters, for the patient to use it for more than 90 days, they're going to have to buy more than one 15-gram tube. With the 30-gram tube that we offer, it's a better value for scars that are longer than 8 centimeters or scars like burn scars or road rash scars that are covering a large area because you're going to use more product, it lasts longer, and it's usually less expensive than buying 2 15-gram tubes. So it presents a value. So your tummy tuck patients, your breast reduction patients, brachioplasty patients, anything where you would potentially use either a breast kit or a or the long strip, the 2.5 centimeter long strip, would be an appropriate place for the 30-gram tube and is a better value. So the instructions for use for NewGel Plus E topical gel is to first wait. Don't begin using it until the wound or incision has healed or the sutures have been removed. Don't use it on an open wound, just like Mike was saying with the sheeting. You want to wash and dry the area before each application and apply nothing on the skin before applying NewGel Plus E. You apply a very thin layer of NewGel Plus E to the area being treated and you just gently massage it. Oops. You want to apply it at least twice a day, and then reapplication is recommended after bathing, swimming, or exercising. So with a strip, you would take it off when you bathe and then put it back on. If you are bathing, swimming, in between the times that you would normally be applying it, you may want to reapply it because those types of activities will most likely will remove some of the product from the area. Once it's dry, which is usually within 1 to 2 minutes, it can be covered by clothing, cosmetics, sunblock, bandages, pressure garments, anything like that. Just wait for it to dry. because otherwise those things can rub it off. Do not apply it under NewGel Plus sheeting, or the sheeting will lose its effectiveness or adhesiveness. A lot of people think that, oh, you have a gel and a sheet, so you use one and then you put you put the gel on and you put the sheet over top of it. Nope. That does not work. It will not stick. So it's a one or the other, or an alternating thing, but you don't want to use both products at the same time. And just like the sheeting, we recommend using it for a minimum of 3 months, and it can be used up to 6 months, or as long as continuous improvement is being seen by the patient. We actually have some doctors in the United States who like the idea of having a patient come back to them to purchase these products. And so they'll have them use it for a year so they can get them to keep coming back to their office, so that maybe they can get them to have some Botox or some fillers or some procedure while they're coming into the office. So this is just a quick review of the instructions for use. I'm not going to go over it again, but this kind of puts all of the instructions in one place, and you'll have this for reference. Again, just remembering, once the wound has closed, no bleeding or oozing, and after any removable stitches have been removed. So no sooner than 7 to 10 days. And with the sheeting, you may want to wait a little bit longer than that, because just the act of pulling it off the skin, if it hasn't healed well, it can pull the scabs off and pull things off there, which is going to be detrimental to the end result of the scar. And then, your key selling points, your unique selling points for NewGel Plus E is the fact that it's registered as a medical device. It has vitamin E added to provide moisture to the scar area. It has a soft, silky feel. It dries quickly. It's not sticky. You have 15 gram and 30 gram options to provide a better value for larger scars. It is available with sunscreen and without sunscreen. I'll have a slide next that kind of reviews a quick review of what our NewGel Plus UV is. And then also, just like our sheeting, we manufacture it ourselves in our own FDA registered, ISO certified facility. So we have total control over quality. It's not a contract manufacturer. The doctor and the distributor can be confident that we are managing the quality ourselves, made in USA, all of that. So recently we launched the NewGel Plus UV, and I don't know if any of you on the line are currently selling it or not yet, but this is a great product because it's the first silicone scar gel that's combined with a mineral sunscreen. It features a medical grade silicone gel, essentially the NewGel Plus E. We took the vitamin E out of this and added 20% micronized zinc oxide, which achieves a sun protection factor of 30, which is the US measurement of sun protection. The great thing about it is zinc oxide is a mineral sunscreen. It stays on the surface of the skin just like silicone does not penetrate into the skin, as opposed to chemical sunscreens, which the way chemical sunscreens work, things like avobenzone and oxybenzone and all of these types of things, the way that they work is they absorb into the skin and they allow the sun rays to penetrate the skin and they turn it into heat energy, and so to protect the skin below. So you're basically kind of cooking your skin with that, because you're still allowing the rays to penetrate the skin, but then you're blocking them from within the skin. With zinc oxide, it actually reflects the light back off of the skin, so the light never gets to the skin, and so it provides a better level of protection. And we do know that new scars, fresher scars that are exposed to the sun become hyperpigmented, which means it's completely different than it being like pink or red as a result of the scar healing process. This will put a brown pigment that's like melanin induced or a melanin-based pigment that can be permanent if it's not prevented. And so what your skin is trying to do, because that scar tissue is immature, you produce extra melanin to try and protect it from the sun, and you'll get brown spots, and probably a lot of you have either have a scar on your body that had turned brown, especially when you're a little and you fall down and scrape your knee. A lot of times, because it's exposed to the sun, those scars will turn brown, and it's very difficult to change that hyperpigmentation once it happens. And oops, we're going to go back here. We are at about an hour and a half, and I know that everybody has a maximum capacity that they can sit and listen. So we're going to stop right there, and we're going to come back to you in maybe 2 weeks, and we'll arrange it, and we will go over all of the different competitor products and how it compares. And we can double check with you all. Ahmed gave me a list. I don't know why this thing is so sensitive. Ahmed gave me a list of some of the competing products. We'll just make sure that those are all accurate, and that we can give you kind of the down low on what's in those products, how does it compare, and what advantages does NewGel Plus have for those. Plus, we'll give you some spreadsheets that have a quick comparison of all of the competitors for easy reference. So with that, does anybody have any other questions? Well, I thank you all for paying attention and listening, and hopefully you've learned more about these great products. And as always, if you have any questions, feel free to ask Ahmed or myself or Mike, and we'd be happy to help you out and get you whatever information you need, or even communicate with a doctor for